I greet you in the spirit of the Lord Jesus Christ, and in the words of 1 Samuel 25:6, long life to you, good health to you and your household, and good health to all that is yours. Welcome to the Health Renaissance channel. Thank you for joining us again. During our previous conversations, we have discussed the relationship between the Bible and health, and then we talked about the ties between religious participation, the Bible and reading it, and health and the impacts thereof. And today we're going to take that discussion a little bit further and talk about social justice and healthcare as a social justice issue. And I'm so very excited to have joining us Reverend A. Kazimir Brown. And I'm so excited because she has a depth of knowledge that will lead us in these discussions here on the Health Renaissance channel. She is a graduate with her master's in public policy with a specialization in social policy from the University of California, Berkeley. And she is a graduate of Yale University's School of Divinity with her master's in divinity. And so she will be talking to us about social justice, healthcare, and the church's relationship to both. So welcome, Reverend Brown. So Reverend Brown, I really appreciate you joining us today. And I just want to start the conversation off with your thoughts on the role of the church and social justice and seeking social justice. What role do you think the church plays in that?
Well, I grew up where I did not see the difference between faith and social justice. To me, they were always one and the same. Being in the Christian tradition, I couldn't imagine saying that I was a follower of Jesus Christ and not be caring about the living situations and conditions that all people were experiencing. And then I would say I grew up in the San Francisco Bay Area. So I was in a very diverse, very eclectic environment. And so I saw the highs of highs when it comes to wealth. And I saw people sleeping underneath freeway passages and awnings, and I just couldn't wrap my head around these disparities. And then when I went to church, it was very clear that we coming together as the body of Christ, the believers of Christ, as people who believe in God and believe in the power of God and believe God is love, we could not say that we truly love somebody, yet we did not care about their living conditions, didn't care about their health, didn't care about their wellness, didn't care about whether they had food on their table or if they had access to education, all those things. So for me, the church has always been a center in which I developed. This is how I'm supposed to be. If I'm to be in relationship with God, then part of that relationship is also being in relationship with my community as well. So I see the church as also, and I would say even a step further, would be how the church as the building. So oftentimes people say, oh, the church is more than building. And it absolutely is. It is the individuals. And as we see during this pandemic, that we have shut down the buildings. And so we have had to operate in a new type of understanding of what the church is. But what I would say about the church building itself, how are we using our physical space to care for the community? And I grew up at a church that opened up its doors, usually during the wintertime, for those folks who are unhoused. And we had food pantries, and we had folks that came in for different community meetings. And so everything about the church should speak to community, should speak to love, should speak to our relationship with God. And that is everything down from the individuals to how we spend our offerings. So for me, they're always one and the same. I can't imagine living in a world where those are separated to me.
I agree with you. And, growing up in Detroit, it was in front of you all the time. And growing up in this area, the churches were always a part of finding solutions to the problems. and not actively trying to separate itself from what is surrounding them. And you mentioned disparities, and of course, that's a kind of a hot topic right now, and that people are finally recognizing the disparities that people of color experience, particularly Black Americans experience, in all different divisions of life. And I've spent part of my career, or most of my career, looking at health disparities and looking at our disparities related to from public health perspectives. And we know that we have race, we have ethnicity, we have socioeconomic status, and we even have geography as barriers to accessing care. And so these seem insurmountable sometimes. And you spoke about having the church and the building of the church serve the community in a greater way. And I do believe there's a place for that. And I'm baffled why kind of the society at large doesn't recognize that looking at people's health and the provision of healthcare services and the attainment of optimal health is why that's not a goal, society-wide, countrywide. I love a quote that I've read oftentimes from Reverend Dr. Martin Luther King Jr. And he says, of all forms of inequality, injustice in health is the most shocking and inhumane. And so I kind of live my life around that, and I absolutely concur with him, but I wonder why no one else kind of sees it in that way, or why very few people see it in that way, or we see it and we don't do a lot about it. And one of my heroes or sheroes of public health and epidemiology is Dr. Kamara Phyllis Jones. And she is out of this world, but and I think she worked out of California for a while, so you might be familiar with her. But in a recent article she had, she said that the health data for life expectancy for race shows that a Black man in DC has a shorter life expectancy than a man in the Gaza Strip or any other violently or war-riddled place on Earth.
Wow.
And so what she is saying, what she's calling on Earth, right? And what she's saying, what she's calling attention to is that the killing of Black people is a public health crisis. So for me, and my focus being on optimal health attainment, but it all kind of comes together now. It's not just about taking care of our bodies, but it's everybody else taking care of our bodies too. And so all of this is kind of coming together under one for me, and that the killing of Black people is a public health crisis, while at the same time, it's a public health crisis that we're dying of chronic diseases disproportionately, while at the same time, we are at a place where we are in the midst of a pandemic where Black people are fighting for their lives and their humanity all at the same time. And so I just really wanted to talk a little bit about some of your thoughts on kind of the role of the church and in seeking healthcare, in seeking health and wellness in general.
Oh my goodness. Yeah. One of the things that came to mind is that when I think about the quote that you read was, why aren't we elevating what's happening to being one of the top issues? And I think part of that has to do with, when we think of health, we often think of individuals. Like that's that person's health, and this is my health, and it's not connected. And so when we individualize health and wellness to kind of looking at the person as like, you need to take care of yourself, and that person needs to take care of themselves. And really what we provide as society is we'll provide general tools in which, everybody can use at the same rate. And then we should all be healthy when we have access to it, which is such a fallacy, which doesn't exist.
Never works that way.
Never works out that way. Why? Because one, our individual health is not purely our health. my health is very much connected to everybody else in my community. My health is very much connected to people living across the country and, quite frankly, around the world, because when we talk about air pollution, the air doesn't just sit, folks, it travels around the world. And so when we think about health, I think one of the biggest things that we can start to help elevate this is to start thinking about it as a collective issue. And that what affects our neighbor and our loved ones is directly affecting us. And it doesn't have to do with, is it a genetic thing or certain communities predisposed to certain things. I think what the church can do to help people center this is, one, talking very frankly about our health.
Yeah.
I think oftentimes when we talk about health in the pulpits, oftentimes certain conversations are just not had. Certain things are looked down upon. And we even see that in the Bibles. We see that there is parables in which there is a person who has a sickness, who is blind, and they ask, well, what in their family caused this? Which is like, nothing in their family caused this. But we today have sort of similar beliefs. Like, what did you do to cause your sickness? Oh, you weren't eating right. Oh, you weren't exercising. Oh, you were living in this particular area, blaming the individual.
Yes.
Which, all those things are systemic. Why a person doesn't have access to certain foods? Why is a person having to live in conditions where there is environmental racism and injustices happening and pollution plants around them? Why is a person having to not be able to have enough time to rest because they're working 2 to 3 jobs in order to make a living? So even in the pulpit, we can do a huge service to folks by centering why health and why health is so important, and why our health communally, like that narrative needs to shift from individual to communal. So when you said that was a huge thing. And I also thought about our proximity to one another. And so oftentimes when you're saying that people are just now seeing what's happening, it was like, this is not something new. This is not something that
not at all
of the ground yesterday. This has always been around. But what this does say is that we are oftentimes in environments that silo us from being in proximity with our neighbors. And we oftentimes, that means that our geographic locations and where we go to work and where we socialize and where we live is oftentimes isolated from other people who are having different backgrounds. So when you have, and once again, this is all structural, this is all systemic, it is by design. It is not something that people that is randomly happens. And we know this because if you can look at data and you can see a grouping of particular people that it's affecting, it's not by accident, it's by design.
Absolutely. Absolutely.
And so also when I think about what the church can do when it comes to health, having those frank conversations, and then also like when I think about the Black community. And I would say not just Black community, but I would imagine this is applicable to a lot of communities where we don't talk about mental health. And that's stigmatized. And then we start stigmatizing certain sicknesses or illnesses or things that are happening. And that is completely unhelpful. That is not life-giving to anybody. It diminishes people's realities. And also when you start demonizing certain illnesses, you're demonizing that person.
Yes.
And when you start demonizing an individual, you are taking away you're taking away their humanity. You're not actually looking at them as a human anymore. You're looking at them as being other. And
Absolutely.
we cannot have that. We cannot have that in the church. We cannot have that being preached, because what we believe about one another is what we also are tying to our beliefs with God.
Mm-hmm. Mm-hmm. Yeah.
So I just think there's.
And it's interesting that you bring up mental health, because I do want to touch on that, because I think oftentimes, just generally as Americans, we don't pay attention to mental health in the way that we should. And then particularly in the Black community, there are some stigmatisms related to that. And I want to, I think it's surfacing a little bit more. In two examples that we've seen in the recent weeks. There was the gentleman who's a vet, who is, I think is in San Antonio, and his family called the Red Cross because he was having a episode of paranoia, of extreme paranoia, and they were fearful that he might do something to himself, and they called Red Cross because they did not want to call the police, because they were fearful of what the police would do, because they are not trained or ill-equipped or choose not to treat people with mental health as humans. So they called the Red Cross. The Red Cross, I guess, at the time just felt like they didn't have the bandwidth. They called the local police, and then he ends up dead at the end of the day. There's one less Black man, and it's all because he was having a severe mental health issue in that moment. And then you hear the same of the gentleman in Rochester, New York, who was having a mental health episode as well. The brother was standing there telling the police that, and they still subdued him and ended up suffocating him. And that was just maybe 2 or 3 days ago. And so we have, not only are they killing Black men for what they say is that they're being non-compliant, but they're killing them for having mental illnesses as well. And, in addition to already just killing them because they're Black. So I think that mental health and access to resources for mental health has kind of come to the surface a little bit more on why we need it, and particularly in the Black community, and we can't kind of just shrug it away any longer. I think historically it's been thought that because we are such a strong people, because we come from a strong background where we've had to shrug off a lot in order just to survive, that the thought was, for mental health issues and, depression and all of these other things were largely thought of as just weaknesses or things that you can just get over. And I think now we're finding that there are multiple layers to optimal mental health. And many of them are due to chemical imbalances that you can't just shrug off. They actually have to be treated. And so it's all kind of converging at the same time. And it's interesting to me to see that everything is coming together at once. And then the question is, how do we tackle it all at the same time? And then can it be? And then you said something else that really triggered a thought in me. And I've been thinking a lot and kind of meditating on the phrase, "I can't breathe." And I think for me, it's such a poignant statement, in that is really kind of the reality of Blacks and in their general existence. We have trouble just breathing through it all. I can't breathe because I'm being killed by policemen, actively killed and murdered in a street. I can't breathe because I have COVID and I live in an area where I don't have access to respirators. I can't breathe because I'm a Black child who's disproportionately affected by and diseased by asthma. I can't breathe because not only am I a Black child with asthma, but I'm living in these areas that have excess amounts of environmental pollution that are purposely placed in the places where I live. Mm-hmm. So I can't breathe. I just generally can't breathe. Yeah. And it just, it hits me in so many ways when I see it on t-shirts, and I'm seeing it on masks now. And it really is kind of a general cry of the Black person. Just, I can't breathe.